Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the governor this week unveiled a $28.4 billion budget, about 3.4% in new spending. Joining me to talk about that are two of the Capitol's top reporters, and then we'll have the new president of the Hospital Association to talk about, get his reaction to the new budget, Pennsylvania politics and government, in depth and in detail. And guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, the governor unveiled this huge budget. There's been all sorts of reactions. We're going to go over some of the highlights for you. State budget for the next fiscal year. Joining me is Matt Belanger, WGAL News 8. He's the Capitol correspondent for them. And, of course, we have Laura Olson from the Pittsburgh Post-Gazette. And I want to point this out. This is Laura's swan song. She's heading off to where else? Sacramento, to cover California politics and government for the Associated Press. Congratulations, Laura.
Thank you. Swapping out capitals.
There you go. All right. Let's start. Matt, I'll start with you. Governor, no doubt about it, this budget has a number of huge items in it, some of them controversial. What do you think are the two, as you reported, what were the two or three highlights?
The things that stick out. I mean,
Yes,
clearly, I think this budget is less austere than some of the governors prior. I mean, there are some moderate spending increases in lots of areas. That was certainly a headline. But when you hear reaction to this budget, you're hearing two distinct perspectives. Some calling this a budget of smoke and mirrors, a propped-up house of cards. Others saying the governor's done a job well done.
Do you say Democrats in that first point?
Well, I mean, I think you can largely draw lines, but we'll leave the parties out of it for now and just say two sides.
Okay.
But they're really honing in on some areas where dollars are included for plans that are not yet accomplished, like privatizing the lottery, like dismantling the state-run wine and spirit stores. Money's included in that budget that's not yet guaranteed, and a lot of people don't like that.
All right, we're going to get into a couple of the specifics. Particularly, we're going to talk about the whole business of privatizing the state stores. Maybe talk a little bit about transportation funding. Laura, what was your takeaway?
Well, the other big piece of this is his plan for how to overhaul the pension system. We've been hearing for the past year that's this tapeworm that's eating up the budget. And there are kind of two components to that. One component is these long-term reforms when we have new employees to put them in a defined contribution plan instead of the defined benefit plan that we know as the pension plans, but also to change how the state would, its required payments for that upcoming years, and that would be where some of those immediate savings come in.
Right. And
so in order to be able to spend more money on public education, to spend more money in some of the other areas that he outlined in such a different move than the last couple of years, we've got to find some of those savings, and some of the lawmakers were a little lukewarm about whether they want to draw out those payments any further than we already have.
Good opening. All right. No new taxes, am I right?
Right.
No new taxes.
Cuts business taxes.
We'll see about what they're going to do with funding roads and bridges with the wholesale tax. We'll talk about that in a minute. But modest spending increase, 2.4, is it 2.4%? I think I said 3.4. It's actually 2.4% increase. Any cuts to big programs, Matt? I didn't see any. Did you?
No. I think the losers, if you want to identify those in the budget here, are potentially state workers who will have difficult decisions to make about the pension
if
proposal.
They pass the law.
Correct.
Okay.
And there are about 400 layoffs included in this spending plan, authorized by the spending plan of state employees.
All right, Laura. Let's start with liquor privatization. The voters, support it. Done a lot without a lot of intensity. It's hugely controversial. What are the parameters of that? Just sort of the outline for the folks.
Sure, and so this would be kind of phased in over a couple of years to be able to auction off those licenses to private retailers. So we'd see some of these big box stores being able to sell, I believe it's beer and wine.
Right.
Beer distributors would get some more authority to be able to sell
smaller quantities of that beer.
And I believe wine as well. And the money from that is where most of the attention has been. That we'd be getting about $1 billion in new revenue by auctioning off these licenses, and that's what he's setting aside as this grant program for public schools.
Yeah,
so while it's not tied in specifically, it's not
Right.
it's not being backfilled into what the schools would automatically getting. It's some new money for education, which makes it a little bit harder to turn down.
Yeah, the governor's talking about $90 million in new spending that's not tied to the privatization of of the state store system
For schools.
For schools, that's right.
And the line item where they always get
that's right.
their basic subsidy.
4 grant programs, $1 billion. Is that sort of the carrot out there for school supporters to say we want the $1 billion?
Of course it is. I mean, there are two big changes for this proposal to privatize alcohol sales in the state this time around. One of them is that the money is not just this kind of ambiguous cloud of dollars that would benefit the state in some way or another. He is going out and saying this is going to be earmarked for education. So I think that's very intentional to try and rally support. The other thing we have to talk about is beer. And right from the get-go here, the governor's talking about allowing six-pack sales at grocery stores. And that's something we didn't see. And the public didn't really understand why it wasn't included in prior proposals to privatize this system. And so he's hitting that right up front.
All right, we're going to run to a break. When we come back, we're going to talk about roads and bridges. The voters of the state say they want their roads and bridges fixed. We'll see if there's a couple of ideas the governor has put forth that will get through the Pennsylvania legislature when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking about the governor's $28.4 billion. I got that right, a 2.4% increase over last year's budget. As we talked about, modest increases to a bunch of programs. Candidly, Democrats not happy about it. Their reaction was pretty swift and it's sometimes emotional after the budget announcement. Republicans, for the most part, seem to be supporting. Do I got that narrative about right?
Yeah.
I mean, you all were up there covering it. You interviewed those folks.
I mean, isn't that what we expected?
Yeah. That's
party lines.
Pretty much what we would have expected. All right, Laura, let's talk about roads and bridges. We got something like 7,000 miles of roads that are in need of repair, 25% of the bridges. Almost everybody agrees it needs to be done. It's figuring out how to pay for it.
Yeah. The governor has agreed that it's needed to be done. We've just been waiting for him to finally come out with a plan after his advisory commission had released some suggestions. And I think the biggest reaction that we noticed was people who are just kind of underwhelmed by the number, that this wouldn't raise as much as his advisory commission had suggested. He leaves hiking some of the registration fees for your registering your car and renewing your license. He leaves those off out of this plan. It's mostly based on lifting this cap on the wholesale price of gasoline.
Right.
And so while
that
that raises...
It's something like $1.25 a gallon, take the cap off to let it float
cap
to
on
the
current tax on that.
On the tax,
And so while that raises about $510 million in the first year, about $5 billion over 5 years, that's a much smaller number than what his commission had said we really need to make these projects happen.
What was the reaction? He also wants to lower a tax that we would pay from 12 cents to 10. Is that liquid fuels tax? And that would be reflected. So you're kind of saying,
or something.
Relatively modest. So we get paid less on one hand and then more because the gasoline station owners are going to do what with the tax?
Well, and that's the interesting part of this, because by the governor saying, well, we're also going to kind of roll back this liquid fuels tax, he's almost inherently admitting that lifting the cap on the tax of that wholesale price of gasoline is going to eventually, because someone's paying more tax along the way, right? We're getting more money for road and bridge repairs. And so the belief is, and lots of people have acknowledged, that that extra cost will trickle its way down to drivers and end up in the price we pay at the pump. And so I found it very interesting that the governor came out and said, oh, but by the way, we're going to roll back this other tax to try and offset the increase. He's inherently acknowledging that drivers may end up paying more.
Do you agree with that?
Oh, and that's the tax, as I understand it, I think is more directly tied to like what you're actually seeing at the pump. The wholesale price is a little bit further up the food chain, and so it's a little bit harder to see the direct impact. But this other tax thing is decreasing. It's a little bit closer to the consumer.
Yeah, the consensus is that ultimately some part of that will get passed along.
Like a nickel maybe for the first year or so. I mean, we might see several cents.
All right, here's the $64,000 question. You have to be a little older to understand what $64,000 means.
I know.
The budget. We need to use billions.
I know, we're going to do billions, but here's the $64,000. What was the reaction that you got, Matt? I'll start with you when you interviewed folks. I mean, lawmakers to that. Or were they generally saying this is something we ought to do?
About transportation.
Yeah, I'm only talking about the wholesale tax.
This was a general feeling. Laura, you touched on this. It was underwhelming for a lot of people.
Really?
I mean, I think the number that the commission recommended was $3 billion a year, and he's coming out with something that's much less than that. We knew going into the speech, we expected him to, the large mechanics of this plan to be the uncapping of that tax on wholesale price of gasoline, and that's ended up being true. And so there was a general feeling of, okay, well, if this is his plan, we're not too sure that this is going far enough to meet the state's needs.
The most interesting reaction I heard was from the Senate Transportation Committee Chairman, Senator John Rafferty, who the quote that my colleague received from him was, we're not going to do transportation light, we're going to do transportation. He wants to put more money back in it.
Does that mean increased license fees and registration fees, perhaps?
He said everything from that advisory commission is still on the table from his perspective, and so they have to get the legislature on board to show the governor that they can get it passed.
Can we talk about the elephant in the room, though?
Go ahead.
The governor's promised not to raise taxes, and this whole conversation is going to tip off a debate about what is a tax increase. Is uncapping a tax? I mean, someone's paying more along the way here. So is a tax increase only when you admit it's a tax increase, or is it when people pay more, period?
How about calling it a technical adjustment? A technical adjustment by raising...
Well, that would be a technicality, and I don't know that everyone's going to buy into that when gas prices go up.
Yeah, I get it. Well, look, great update. Thanks for doing this. I think we have a better sense about where it's likely to go. Budget going to get passed on time? No, Laura, you're going to be out in Sacramento, but you're going to have to to pay attention to this anyway.
I will still be watching.
I know you will.
That was a promise that Senator Pileggi and the House Republican leaders made. They said we will get it done on time.
And other than liquor privatization, transportation funding, and pensions, the rest of it looks pretty routine, or am I wrong?
Well, no, here's what's going to happen. I don't want to say the crystal ball. Let's not put it that strongly. But we're going to have to watch and see if the governor is willing to have a late budget in order to get all of these other priorities accomplished. Is he willing to sacrifice that to get his plan on transportation?
There's always the fall if they actually come back, which they sometimes do, but not for long periods of time. All right, we're going to hear from the new president of the Hospital and Healthsystem Association. We're going to get his reaction on the healthcare side to the governor's proposal and the important subject of Medicaid expansion following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. We're going to get a reaction to the healthcare side of the governor's budget. And joining me for the first time is the new president of the Hospital and Healthsystem Association, Andy Carter. He was formerly the head CEO of the Visiting Nurses Association of America. And I got to get this in. He's a Georgetown University guy. So's the president of F&M, Dan Porterfield. We're going to have to, I think, get these two guys together. You don't root for basketball, right? You're not a basketball fan, right?
Well, you got to follow the Hoyas.
I know you do. All right, let's get down to the serious stuff. Everybody was not quite sure, you know, when the Governor Corbett delivered a message about what he was going to do about Medicaid. As you know, his administration had sent some letters off to Health and Human Services to get some answers about funding and regulation. I'm not sure the door is completely closed, but I know that your folks, and you've talked about this before, have indicated support for the Medicaid expansion. Why is that important? Why do you think the governor ought to do the Medicaid expansion?
Well, let me talk first about what I saw as strong dimensions of the governor's budget on health care.
Okay.
He did remain committed to hospital care in this Commonwealth in this budget. You know, I'm new here, and folks have told me that previous budgets out of the block were very, very tough with deep cuts. So we're pretty encouraged that out of the starting blocks, hospital reimbursements and therefore care to Pennsylvanians is in a good starting place. I think as I listen to the governor, I'm hearing, Terry, more in the way of being open to an ongoing conversation about expanding Medicare so that, and here's why I think it's important. You have about 650,000 Pennsylvanians that are uninsured. And this expansion initiative is the best way to make a real dent in getting those folks covered. Now, the governor has laid out questions that he needs answered, and I think working with the legislature and with the healthcare community, I think the governor is skeptical, and I respect that, but I think he's going to be open to, if the answers are okay, we'll get there by the end of June.
Now, one of the reasons I think that a lot of people in the healthcare industry, business, service providers want the Medicaid expansion is that you're already providing the health care in many cases, but you're not being compensated for it.
Well, to a pretty big degree, we've got $1 billion a year that hospitals are committing to care that they're not getting reimbursed for. And that's a real strain on their ability to do everything we want hospitals to do. We want hospitals to get better at providing quality of care. We want them to get better at patient safety, and we can maybe talk about the progress we're making on that. But that $1 billion a year is a huge strain on what they can do. And Medicaid expansion can offset a huge amount of that. I mean, over the next decade, if the Commonwealth does that, you know, we think it's going to be something on the order of $38 billion over a decade that will come to Pennsylvania for health care. That if we expand Medicaid.
Right, will come.
It will come.
If you don't, won't come.
If we don't do it, that's $38 billion of federal dollars that will not come here.
The other point that has been brought up over and over again is that, you know, you have folks who don't have coverage, so either they wait until some illness gets to the point where it's either life-threatening or they think it is, and they've not been treated for a lengthy period of time, so they show up, whether it's, you know, to one of your hospital's emergency rooms or to a physician's office or wherever they would access the healthcare system. And all of a sudden, as I put it, there are two dimensions. It's the health care itself, you know, the individual's, the personal health situation. But what may have cost $1,000 now costs $50,000. So don't we just delay the inevitable problem by not having folks
Terry, I think that's the kind of conversation we need to have with the governor and the legislature, is not only looking with your green eye shades at today's budget numbers, but you want to look out 10 years to the impact of not covering folks, because you're exactly right. There's study after study that shows that people with insurance do a better job getting care early when it's cheaper.
All right, I'm talking with Andy Carter. He's the new president and CEO of the Hospital and Healthsystem Association of Pennsylvania. We're going to continue this conversation. I want to pursue this a little bit, and I want to ask him about the gains made in patient safety, something that I know everybody is interested in, after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program with Andy Carter, the new president of Hospital and Health System Association. Before we turn to patient safety, something I know you want to talk about, the other point about this is we've been doing a lot of programming here about wellness, meaning let's prevent people from getting sick and having health care problems. So in a sense, I see a correlation between the Medicaid expansion and having coverage and the wellness programs. Am I on Mars about that? Or
No. Coverage is good for getting in and preventing problems before they start. But it's not only the Medicaid expansion that's helping that happen. I mean, I think one of the strengths of the Affordable Care Act, which we supported from the beginning, is that it's encouraging everybody in healthcare to pay attention to patients as human beings from start to finish, and not just to go in and do an intervention and take care of them when they're sick, but to think, how am I going to get this patient healthy? And that kind of accountability is good for healthcare.
Yeah, let's talk about patient safety. I know that's something, there's an annual report now that talks about steps being made to make sure that hospital-acquired infections and other things don't. What's the status? Give us an update on that.
Well, we're making progress. I mean, nobody likes the fact that hospitals have to work on improving quality, but we are doing it. You go into a hospital, you have a risk of infection. You have a risk of things like when you're supposed to have your right shoulder operated on, accidentally your left one gets done. That happens about once a week in Pennsylvania, and hospitals care a great deal about that. So, for example, we've pulled together already almost 140 of our members are working on any number of up to 10 projects to improve safety, to reduce infection rates, and an example is infections acquired when you get a tube put into your body. Those infections have gone down something like 36%. And we're going to keep working on that year in, year out. We're working with the federal government. We're working with partners here in the Commonwealth and with our members. And we do it by collaborating with each other, and we can continue making the kinds of improvements that our patients expect and that people who are paying the bills expect.
Right.
Because you don't want to have to pay twice for things. Yeah. And hospitals are taking it all very seriously.
Yeah, well, I want to thank you for coming in for this update. I mean, when I go in, I have like 2 knee replacements, and they put these big circles on the individual knee. And for some reason, I never really worried about whether they were going to do the wrong knee. I mean, I've never saw so many people just make sure that they were doing, doing the right knee. Go ahead.
Well, Terry, we encourage patients to be very active in taking care of themselves. So when you're going into a hospital, pay attention, work with your caregivers, be aggressive, stand up for yourself.
Well, look, I want you to make sure you come on regularly. Through the course of this year, we're going to have big debates over a lot of health care changes, the implementation of the Affordable Care Act. We got this business with Medicaid. We'll see what the governor does. Thanks for coming on. We appreciate it.
Thank you, Terry.
All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.